Today, we'll be discussing the psychological burden of cancer, a study of depressive symptoms and related factors. This presentation highlights crucial insights into the mental health challenges faced by cancer patients and survivors, drawing from a comprehensive study conducted by researchers at the Christine E. Lynn College of Nursing at Florida Atlantic University. Slide 2. Background information. Cancer is a devastating disease that imposes significant burdens on individuals, encompassing physical, emotional, and financial challenges. While advancements in detection and treatment have significantly increased the population of cancer survivors, this prolonged survival, along with the diagnosis and treatment itself, presents its own set of challenges. One of the most prevalent and impactful of these is psychological distress, particularly depressive symptomatology. This psychological distress significantly impacts a patient's quality of life, their adherence to treatment, their physical health outcomes, and even mortality. In fact, cancer patients experience higher rates of depression compared to the general population due to a complex interplay of both physiological and psychological factors. Slide 3. Research question. Despite the well-established link between cancer and depression, there remains a critical need for further exploration into the specific demographic, socioeconomic, and health-related factors that contribute to this burden. Much of the existing research in this area has relied on smaller samples, which can limit the generalizability of findings to the broader U.S. cancer survivor population. To address this, our study utilized data from the National Health Interview Survey, or NHIS, which is an invaluable resource. The NHIS captures extensive health, demographic, and socioeconomic data from a nationally representative population, providing a robust foundation for our research. This led us to our primary research question. Among adults reporting a cancer diagnosis in the United States, what demographic, socioeconomic, and health-related factors are associated with increased depressive symptomatology? Slide 4. Methodology. To answer our research question, we utilized NHIS data specifically from 2022. We performed a subgroup analysis, focusing on individuals who reported being informed of a cancer diagnosis by a doctor or other healthcare professional. Our key outcome measure, or dependent variable, was defined as at least moderate depressive symptomatology. This was determined by a PHQ-8 score of 10 or higher, categorized as a simple yes or no. We then evaluated various demographic, socioeconomic, and health-related independent variables using simple survey logistic regression. For those interested in the technical details, the R packages we utilized included survey, tidyverse, model summary, and data table. Slide 5. Results. Our analysis revealed several statistically significant associations with moderate or greater depressive symptomatology among patients who reported a cancer diagnosis. Examining socioeconomic factors, we identified significant associations with poverty, lower levels of education, and lack of private health insurance. These highlight the profound impact of financial and educational disparities on mental health in this population. In terms of demographic factors, female gender, younger age, and living alone were all significantly associated with increased depressive symptoms. This suggests that certain demographic groups may be more vulnerable to the psychological burden of cancer. Regarding healthcare access and utilization, significant issues included delays in care, not receiving care due to cost, frequent urgent or emergency visits, and overnight hospitalizations. These findings underscore the importance of accessible and affordable healthcare in mitigating depressive symptoms. Finally, co-occurring conditions also played a role, with mild or greater anxiety symptomatology being significantly associated with increased depressive symptoms. This emphasizes the interconnectedness of mental health conditions. Slide 6. Implications for healthcare practice. These findings have several crucial implications for healthcare practice. To effectively address mental health issues, It is vital to prioritize targeted screening and intervention strategies. Healthcare professionals should routinely employ validated tools like the PHQ-8 or PHQ-9 for assessing depression. Furthermore, considering broader social determinants of health is crucial in patient evaluations, as these factors greatly impact mental well being. Secondly, we emphasize the importance of holistic support. Interventions should extend beyond merely addressing psychological needs. They must also incorporate socioeconomic factors and healthcare access issues. A comprehensive approach is vital to genuinely supporting patients. We wholeheartedly advocate for the adoption of integrated care models. This entails the smooth incorporation of mental health support into oncology care. By taking this approach, we can guarantee that mental health is acknowledged and effectively addressed as a vital part of cancer treatment and survivorship. Slide 7. References. Here are the references that informed our study and presentation. We encourage you to explore these valuable resources for a deeper understanding of the topics discussed. Thank you for your time and consideration.
Hey, thank you very much. Do we have any questions from the audience? We have, looks like 1 more minute for questions. This seems like a really important topic. I work in cancer research, so I'm sure it comes up quite a bit. Can you tell us a little bit more about what type of, this was based on a national healthcare data set, is that right?
Yes, so I use the National Health Interview Survey data set. So yes, so some of the limitations are it was self-reported. So again, it's a national survey that the CDC carries out. They ask people a lot of questions about health and cancer and so forth. So that was the data set that I used. Yes, National Health Interview Survey data, national data set.
And was there any comparison to like healthy controls?
There was not. This is a multi-step process. So the first step I should say was just simply looking at people who reported cancer and just seeing if there were relationships between depressive symptomatology and other social determinants of health. So the next step will be, yes, to get that control group employed in a larger sample. I'm on a tenure track, so it has to end in a grant. And so yeah, and so that's the whole premise of the grant is going to be I need money to do that. So not now, but if you knock on wood many times, that is the plan for the future, yes.
Well, I hope that works out because I think it would be a really interesting study. It makes sense that I think your findings about the socioeconomic associations
Right.
with these symptoms are really important in cancer patients, and I would imagine that's true in the general population as well. And I'd be curious if the difference is larger in cancer patients than others. So hopefully you'll get the money so that you can answer that question, and maybe you can come back next year and tell us what
Sure,
you
sure.
found.
I would be happy to do that, sure.
All right. If there are no other questions from the audience, I think we'll wrap up here. And I just wanted to let everyone know that we have a break now for 15 minutes, and the next session will start back at 3 o'clock Eastern time. So whatever time zone that is for you. So 15 minutes.
All righty,
Oh
thank
wait,
you very much.
sorry. I see one more question we can ask quickly. In the chat, it says, by chance, did you run across factors associated with depressive severity in
Yeah,
pediatric patients?
yeah, good question. So the NHIS has two data sets, one for adults, one for pediatrics. I did this for primarily adults, but pediatrics, that is definitely a valid extension. And maybe if time and money permits, I'll be happy to work on that as well. Yeah. But not this past, it was just adults.
Yeah, that's a really good question and would be an interesting extension. All right, thank you so much. We'll see you all after the break in 15 minutes.
All righty, bye-bye.
Yeah. Aye.